So I'm Jim Del Rosso, one of the course directors for Winter Clinical Dermatology 2022, and we have a very exciting session with myself, my good friend and colleague, Dr. Emmy, who we'll get to in a moment, and also Neal, Bhatia, and Julie Harper will be joining us later. But we're talking about clinical pearls and acne and rosacea, and I'm going to start off by saying that Julie, Emmy, and I work very closely with the American Acne and Rosacea Society, which we encourage all of you to become a part of. A lot of great education there. Emmy also runs a fantastic meeting, our meeting, Acne Rosacea meeting, right? We'll talk a little bit more about that. Make sure that you see that coming along, that you check that out. But at Winter Clinical Dermatology here, there are a variety of different pearls. We're going to be talking about subantibiotic dose doxycycline, some of the ways that it's effective in rosacea, and also looking at its ability to affect and reduce relapses long term. Also oral sarecycline and even a low-dose extended-release minocycline formulation with new information and literature. But now I want to turn to my good friend and colleague who knows a tremendous amount about medical and device treatment for acne and rosacea.
I'm going to be talking about lasers and how to use them in relation to your acne and rosacea patients. And I'm going to give 3 pearls, easy as pie, as it relates to post-inflammatory erythema. I'm going to give another pearl when it's safe to laser in relation to oral isotretinoin. And we're going to talk about how redder might be better in terms of laser. Yeah, so I hope you listen to my talk and learn something. But I have a unique skill set of doing a lot of acne and a lot of lasers, and I'm excited to share that with everyone.
I'm Dr. Neal Bhatia from San Diego. As part of a discussion of clinical pearls of rosacea, I emphasize small intestinal bacterial overgrowth from the use of doxycycline, as well as optimizing the correct doses of doxycycline for reducing antibiotic resistance and long-term management of rosacea, keeping in mind that the #1 goal of rosacea patients is to not look red, even more so is to keep them out of the office and let them focus on maintaining themselves with as few items as possible to irritate the skin.
Hi, I'm Dr. Julie Harper from Birmingham, Alabama, here at Winter Clinical, talking about pearls in acne and rosacea. The pearls that I just went over are all about isotretinoin. Number 1, I want us to remember that abstinence really is a reasonable option for those people who are committed to abstinence when taking isotretinoin. I also went over the fact that maybe we're still checking too many labs. Why are we checking cholesterol when it comes to isotretinoin? What are we doing with that? And lastly, how young is too young for isotretinoin? There are publications that take that age way down, even 1 and 2, and I don't think most of us are going to do that, but it's hard to get too young for isotretinoin.